So I'm just going to wrap up the speaking bit of the webinar, talking about including patients in core outcome set development, particularly how is COMET helping with this. So in terms of, could I have the next slide, Heather? So COMET, just to explain, stands for Core Outcome Measures in Effectiveness Trials Initiative. And COMET is really all about bringing people together who are interested in core outcome sets and want to move forward the research in this area. So people come from all around the world, from many, many different areas for health and indeed social care as well. And COMET is really helping in a wide range of ways. Awareness raising about the need for core outcome sets and promoting the uptake of core outcome sets. COMET provides a database and resources to facilitate these aims. So the database is really one of the key things, and people can log on and search that database to find potentially relevant core outcome set studies or identify where a new core outcome set might be needed. COMET also very much encourages an evidence-based approach to core outcome set development, and they provide research advice to research teams and various community of core outcome set developers on exactly that evidence. So as COMET's going along and as the community's going along, we find out better and better ways of developing these core outcome sets. There's a lot of organisations that endorse COMET, so they're listed on the COMET website, and those include a range of patient organisations. So you can find out about that endorsement. Funders also, regulators, a wide range of organisations that are endorsing COMET. So moving on to the next slide. So a key way that COMET is addressing patient contributions and input to core outcome set development is via the POPPIE group, and POPPIE stands for People and Patient Participation, Involvement and Engagement. And this working group was established back in 2004. It's co-chaired by John Turner, who you've already heard from, and Maureen, who you've also heard from, is a member of the group, along with myself and Heather. And we have members from all sorts of various different countries, including, as you've heard from Maureen, in Canada, Germany, Ireland, the USA, Netherlands, as well as the UK. And POPPIE is really a key sort of party in developing some of the resources to help support core outcome set developers in including and involving patients in core outcome set development. So I'll just move on to show some examples of various resources that POPPIE's helped to develop and activities we've been involved in. So there in the top left-hand corner is a image that represents the animation that we've developed, and again that's available on the core outcome set and on the COMET website, and that tells you all about the process of core outcome set development. We've also helped develop lots of plain language resources that people can access and find out about what this is all about, and research groups, core outcome set development groups, can take those resources and tailor them to their own studies. And we've run various workshops to support the core outcome set community who are including patients in their studies. And we've also recently consulted with young people about how they would like to be included. And last but not least, POPPIE, members of POPPIE are founder members of the International patient and public involvement network. And this is all about helping ensure, from our perspective, patient input into core outcome set work is promoted globally. And one of the slightly earlier resources that we developed, so from the workshops that we run with core outcome set developers, we've published a commentary on the lessons, the cumulative lessons we've learnt from those workshops, and that's an open access publication, so it's freely available. And then I just want to move on and talk about a key issue which people often ask about, and that is, how can we assess the quality of an existing core outcome set? So COMET has, through the COS-STAD project, developed minimum standards for core outcome set development. And this is to encourage researchers to achieve at least these thresholds to ensure a certain standard for core outcome set development, and also to help users assess whether a core outcome set should be adopted in practice. And again, that is available, it's open access, so people can have a look at that at their leisure. And then I just want to move on to another common question that we get asked. What if no core outcome set exists for a particular condition? So you've been on the COMET website, you've assured yourself that there isn't a core outcome set. Well, we would really ask to look carefully to make sure that there really isn't a relevant core outcome set. So one that might not exactly be for a particular condition, but might be for a closely related condition, and that might have some relevance at least. So there may be some crossover between core outcome sets. We'd also advise that a team might already have looked at systematic reviews of the evidence to date. If they're working in this field, that's hopefully what a team has done. And from that, they should be aware of the outcomes, at least, that health professionals think are important. And one way forward from there would be to review the literature, the research literature about what matters to patients as well, to bring their perspective in. And then a team might also want to make sure that they've had sufficient patient input and have patient public involvement and engagement in their trial. So this is all about, if you're funded for a trial and there isn't a core outcome set currently available, and there isn't time to actually develop one, these are just suggestions. But of course, ideally, you would be interested in developing a core outcome set with your patient community. And in that case, we'd very much advise that you get in touch with COMET via the contact page on the COMET website, and we've got the address up here on the screen. And of course, the COMET handbook, again, this is open access and freely available, is a wealth of information about the process of core outcome set development. So just moving on to the last slide, which we then hand over to you for questions. So how can COMET and POPPIE work with patient organisations? So these are just a few initial suggestions. We would hope that we have a common interest in raising awareness of core outcome sets and why these are important for research. Facilitating patient involvement and participation in core outcome sets, that's really important, and again, hopefully an area of common interest. Improving the uptake of core outcome sets, so once a core outcome set is developed, can we make sure that it's used, given all the time and effort that's gone into the process? And generally improve core outcome set studies in terms of how they're done and making them accessible and enjoyable, why not? An enjoyable experience for patients to put into. But of course, they're just some initial suggestions, and we're very keen to discuss your views or any other ways that we might work together with patients and patient organisations. So we're very up for suggestions.